Did you know that 1 in 8 men will be diagnosed with prostate cancer at some point in their lives? It's the second most deadly cancer among men, largely because it often stays silent for a long time. Subtle or non-existent early symptoms can lead to late detection, when treatment choices are fewer and outcomes more serious. But there's encouraging news. If caught early, the survival rate can reach 90%. In this video, we'll unpack the key warning signs of prostate cancer, share real-life examples, and discuss risk factors that could increase your chances of developing it. Stick around to the end. These details could make all the difference for you or someone you care about. Disclaimer: the information provided here is for educational purposes only and should not replace professional medical advice. Always consult a qualified healthcare provider if you have concerns about your health. Why is prostate cancer called a silent disease? The prostate is a small gland, roughly the size of a walnut, located just below your bladder and in front of your rectum. It produces most of the fluid that carries sperm. When cells in the prostate mutate and begin multiplying uncontrollably, they form a tumor that can grow very slowly, sometimes over many years. As a result, many men don't feel any changes until the cancer has advanced or spread. One major risk factors: age 50 plus. Your risk rises substantially with age, especially after 50. Men over 50 are advised to discuss screening options with their doctors. Family history genetics. Having a father or brother diagnosed with prostate cancer more than doubles your risk. Specific gene mutations, such as BRCA1 or BRCA2, can lead to more aggressive forms of the disease. Diet and obesity. Diets loaded with processed foods, red meat, and sugary drinks promote chronic inflammation, creating an environment where cancer cells may thrive. Obesity is also linked to more aggressive or recurrent cases. Ethnicity. African American men have higher incidence rates and face higher mortality, due to both genetic factors and disparities in healthcare access. Sedentary lifestyle. Lack of exercise can intensify hormonal imbalances and raise inflammation levels, contributing to the growth of abnormal cells. Exposure to toxins. Chronic contact with industrial chemicals, tobacco, smoke, and certain pesticides may increase your likelihood of cellular damage in the prostate. Having these risk factors doesn't guarantee you'll develop prostate cancer, but it does emphasize why regular checkups are critical, especially if you fall into one or more high-risk categories. 2. 8 major warning signs you shouldn't ignore. Not all prostate issues indicate cancer. Sometimes it's just benign prostatic hyperplasia, BPH, or an infection. However, when these symptoms persist, especially in combination, they can be early indicators of malignancy. Frequent urination and nocturia. What it feels like. You find yourself needing to go to the bathroom constantly, including multiple times at night. Known as nocturia. Why it happens. An enlarged or tumorous prostate can press on the bladder, giving you the sensation of needing to empty it more often or more urgently. Real-life example. Mark, 58, was waking up 3 or 4 times a night to urinate. Even after cutting out liquids in the evening, nothing changed. A checkup revealed a growing prostate tumor constricting his urethra. Impact on daily life. Poor sleep from nighttime bathroom trips leads to fatigue, moodiness, and even elevated blood pressure over time. Pain or burning during urination. What it feels like. A sharp or stinging sensation, sometimes dismissed as a urinary tract infection or just something I ate. Why it happens. A tumor may narrow the urethra, causing friction and inflammation. Chronic bladder retention can also invite recurrent infections that don't clear up with standard antibiotics. Real-life example. John, 52, assumed his burning urination was due to dehydration. Weeks later, it hadn't improved, and tests showed an early-stage prostate tumor restricting his urethra. Takeaway: if antibiotics or increased hydration aren't resolving the discomfort, get a deeper evaluation. Difficulty urinating or weak stream. What it feels like. Struggling to start, a weak or interrupted flow, and dribbling at the end. It can feel like you never fully empty your bladder. Why it happens, whether benign or malignant, an enlarged prostate can constrict the urethra. If cancer is advanced, it can also affect the nerves that control bladder function. Real-life example. Carl, 60, used to joke about having rusty pipes. One night, he experienced a near-complete blockage and had to go to the ER. A tumor was blocking his urethra almost entirely. Health concern. Over time, incomplete emptying can cause back pressure on the kidneys, potentially leading to kidney damage if untreated. Blood in urine or semen. Hematuria/hematospermia. What it looks like: urine that appears pink, red, or brown. Semen might have streaks of blood, though sometimes you only find microscopic traces during a lab test. Why it happens? Tumors can disrupt small blood vessels, causing bleeding. Infections or kidney stones can also lead to blood in urine, so it's crucial to rule out cancer if this persists. Real-life example. Stephen, 55, noticed his urine was pink after a long jog. Thinking he had pushed himself too hard, he ignored it. A thorough check later showed a malignant tumor near the bladder neck. No, blood, no matter how slight, is never a normal finding. Always seek medical attention if you notice any discoloration or bleeding. Lower back, hip, or leg pain. What it feels like: persistent. Deep aches that may get worse at night or when lying down. Over-the-counter painkillers offer little relief. Why it happens? Prostate cancer commonly metastasizes to bones in the spine or pelvis, creating lesions that can weaken bone structure and cause pain. Real-life example. Sam, 62, tried chiropractic treatments, massage therapy, and pain medications for chronic back pain. Eventually, an MRI revealed metastatic prostate cancer in his pelvic bones. Warning sign: bone pain that doesn't improve with rest or typical therapies should always be investigated, particularly in men over 50. Numbness, tingling, or weakness in legs/feet. What it feels like: pins and needle sensations that can progress into notable weakness, difficulty walking, or a feeling of heavy legs. Why it happens? As tumors grow or spread to the spine, they can compress the spinal cord or nerve roots in the lumbar area. Swelling due to obstructed lymphatic flow can also exacerbate nerve pressure. Real-life example. Brandon, 59, chalked up his tingling foot to poor circulation. 2 months later, he needed a cane. A scan showed a prostate tumor impinging on the nerves near his spine. Medical emergency. Sudden weakness in the legs may signal spinal cord compression, requiring immediate treatment to prevent permanent damage. Pain around the rectum or while sitting. What it feels like: a sensation of pressure, fullness, or a sharp ache in the rectal or perineal region, often worse when seated. Why it happens? The prostate borders the rectum. Enlargement or inflammation of the prostate can easily mimic hemorrhoids, proctitis, or anal fissures by creating a constant feeling of pressure. Men might try over-the-counter hemorrhoid creams or sitz baths with little relief. Real-life example. Greg, 54, spent months convinced he had chronic hemorrhoids. Sitz baths and topical treatments did nothing. A medical exam revealed a significant prostate tumor pressing against his rectum. Tip: if hemorrhoid treatments fail to ease chronic rectal discomfort, don't hesitate to get a prostate exam. Painful ejaculation. What it feels like: sharp or burning pain during or shortly after orgasm, sometimes accompanied by changes in semen color or thickness. Why it happens? The prostate is responsible for a significant portion of seminal fluid. Inflammation or a tumor can disrupt ducts and nerve endings, causing intense discomfort. Chronic inflammation may coexist with early-stage cancer. Real-life example. Jacob, 40, experienced severe pain during ejaculation, prompting him to avoid sexual activity. A medical evaluation uncovered a small tumor affecting key areas of his prostate. Emotional toll. Men may avoid intimacy out of fear of pain, leading to added stress and possible relationship strain. 3. Why these symptoms deserve serious attention. Not every sign spells cancer. Some could simply indicate an infection or benign prostatic hyperplasia, BPH. However, prostate cancer typically whispers before it becomes critical. If these issues are persistent, intensifying, or appear in combination, don't delay seeing a healthcare professional. Early detection significantly broadens your treatment possibilities and increases the likelihood of a favorable outcome. For prevention and diagnosis, what should you do next? Regular checkups, PSA tests. Prostate-specific antigen levels in the blood can hint at prostate problems. Elevated PSA isn't definitive proof of cancer, but it's often the first flag for further tests like ultrasound, MRI, or biopsy. Digital rectal exam. DRE, though sometimes met with discomfort or hesitation, this physical exam can detect lumps or hard areas in the prostate that merit more thorough investigation. Healthy lifestyle adjustments. Exercise. Aim for at least 150 minutes of moderate activity per week. Brisk walks, swimming, cycling, or light weight training. Balanced diet. Incorporate fruits, vegetables. Tomatoes are rich in lycopene, whole grains, and lean proteins. Limit highly processed foods, red meat, and sugary drinks. Stay hydrated and manage weight. Maintaining a healthy BMI can reduce the risk of more aggressive cancers and improve overall health. Avoid smoking and limit alcohol. Both can increase inflammation and cell damage, creating an environment where cancer cells can thrive more easily. Active surveillance when appropriate. In cases of slow-growing prostate cancer, some doctors recommend watchful waiting or active surveillance, which involves regular blood tests and imaging to track the tumor's growth before deciding on surgery, radiation, or other interventions. Encourage open communication. Keep a symptom journal, noting frequency, duration, and severity. Share any family history of cancers, especially prostate, breast, or ovarian cancer, since certain gene mutations can affect more than one type of cancer. 5. Conclusion. Prostate cancer is often silent at first, but it typically gives you a few hints if you pay close attention. Frequent or painful urination, difficulty urinating, blood in urine or semen, chronic lower back or pelvic pain, tingling or weakness in the legs, rectal pressure, and painful ejaculation. Any of these could be a sign that something is amiss. Schedule a checkup. If you've been experiencing any of these symptoms, especially for several weeks, make an appointment with your healthcare provider. Share this video. Spread awareness to friends, family members, and colleagues. You never know who might be silently dealing with these problems. Comment below if you or someone you know has gone through similar symptoms. Sharing your story could encourage others to seek help sooner. Remember the upside. When detected early, prostate cancer has a very high treatability rate, allowing many men to lead long, healthy lives post-diagnosis. Thank you for watching, and please remember, your health is in your hands. Don't ignore the subtle signals your body sends. Take action, stay informed, and help others do the same. Together, we can fight prostate cancer by catching it early and getting the right treatment in time. Until next time, take care of yourself and those around you.